to the Turd Nerds, the functional gastroenterology podcast where we talk about all things poop. We are your hosts, Dr. Rebecca Sand. I'm a naturopathic physician specializing in gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and functional medicine.
And I'm Dr. Alana Gurvich, a naturopathic physician board certified in naturopathic gastroenterology.
Before we take the plunge into today's episode, we would love to have you check out our new website, turdnerdspod.com, and check us out on YouTube. Links in the bio.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
All right, welcome back, everyone. We're here for another exciting episode of Turd Nerds. We're going to be talking about multiple other causes of bloating.
Yeah, because we never see patients who are bloated, ever.
We only covered 2 so far, but it took a while. So we have.
It's a big thing.
It's a big topic.
We didn't talk about this in the first series, but bloating makes people really tired.
Oh yeah.
They're just uncomfortable all the time.
I think it just puts this like toll on your body. Like if something's irritated, your body's kind of like focused on dealing with that. But people are so brain fogged and fatigued, and I think that might be even worse than the bloating. Sometimes. So
it's true.
Yep.
Yeah. So check out the first episode in this series on bloating, because we go through 2 huge causes that often get missed of bloating, which is too much gas in or gas can't get out, and all the different ways that can kind of play out. But today we're going to go through a couple others, starting with one that is finally getting a lot more traction and is super pesky, histamine.
Oh, histamine.
Good old histamine.
Good old histamine.
It took me so long to admit that histamine was a problem.
I know.
Now you love it.
Well, now you just can't not see it. I can't not see it. Right. I think that's going to happen with me, with infectious diseases pretty soon.
Yeah.
But I
feel the same way about that. I don't want to go there.
I don't want to go there.
I know.
Luckily, but you know what? Maybe we can support group each other. Maybe when we go together.
That's right. We take the jump.
Yeah, I mean,
we take the plunge.
Or what I lovingly call a CE vacation.
Yeah, right? Just finally learn this stuff. I know, I feel like histamine was that for a lot of us. Yeah. It has a lot of crossovers with our microbiome disturbances that can happen. And
with our environmental disturbances that can happen.
Sure. Yeah, allergies, food allergies, just sensitivities people come into the world with. And the environment we live in is just so inflammatory.
But red dye's out now, right?
Well, no. Red dye has been banned. Red dye has been banned. You are right, but not till 2027.
Why does it take 2?
Because companies have to earn money. I mean,
yeah, but here's the other piece of that.
Companies?
Just stop putting it in.
They haven't been putting it in Europe.
I know. Or Canada, maybe?
No, it is not allowed in most other countries. It's not like a switch is going to be difficult.
I know. Yeah.
Give them 2 years. All right.
Add it to the list, but. Anyway,
so histamine.
How do you think about histamine and bloating?
Okay, so that my big thing, and I have talked to this about in the podcast in the past. Do you bloat from water? Do you wake bloated? Do you wake bloat from water?
Yeah. And I think of it as histamine guts. People with a histamine overload or histamine intolerance or can't break histamine down adequately, they're reactive.
Yeah,
they're just very reactive guts. Yeah. So they will react to things even as simple as water. Mm-hmm. Food sensitivities, at least as what people are paying attention to, are going to be variable. One day they can eat this thing, one day they can't.
Mm-hmm. Right. Or if they're eating pretty healthy and they're still having reactions to lots of things, and you're like, okay, there's something else. It's not just the food quality,
Yeah. It's not just FODMAPs.
Or if they have a 4-food diet.
Right. Yeah. They've removed a lot of things.
And those foods change.
Yeah.
I used to be able to eat these 8 foods, and then all of a sudden, one day, I was just intolerant to this food that I ate every day.
Yeah.
Right.
Very temperamental.
Because it's a total load. It's not like the food. It's the histamine in the food that's triggering their symptoms.
Yeah, which can change with seasons. Or different exposures.
Or how aged it is.
Yeah, if they're taking their Claritin that day, or, lots of things that play a role in it. Yep. So I think of that. What do you guys do for that?
I
bloating.
Always start by giving a sample or giving a trial of cromolyn. Cromolyn sodium is where I usually start, just because, we've talked about it in the past, a workup for histamine is either blood tests that are usually inaccurate.
They're hard to catch.
They're hard to catch. Yeah. And more than they're hard to catch, it's hard to find a lab that does it appropriately.
They're expensive usually. The patient out-of-pocket cost is usually...
Or you could just do H1, H2 blockers too.
H1, H2 blockers, or can you describe
where
that?
I start. You make a sample text that you put into your instructions for all the H1 and H2 blockers they can try. There's really just famotidine for the one.
Yeah.
And then you can rotate through 2-week trials of the other ones to see if any of them work. So I'll have them start the H1.
Like loratadine, cetirizine, like any of those
fexofenadine. I usually don't do cetirizine. It makes people more drowsy than the other ones.
I have
but
people
some
take it at
people
night,
like
though.
it. So you still keep it on the list, and then you can do like a 2 to 4 week trial of one at a time. If it helps at all, then keep that one on. Well, I usually just keep that one on. If it doesn't work at all, then I have them double it. If it works at all, I just do continue it and then add the famotidine and see if they get additional benefit, you know?
So you're not doing them both at the same, because I'm having people dump into both at exactly the same time.
But then I don't know which H1 there is helping them. Right?
I go the opposite, so I have them do both at the same time and then peel it back. But I think I've mentioned this on the podcast. I'm getting a lot of traction treating PMS and PMDD with
histamine.
Pepsid.
Oh, with famotidine?
Yeah. Which is really cool because estrogen stimulates the release of more histamine. So our estrogen's higher in that premenstrual window. Stimulates the release.
Through what part of the cycle would you say?
So our estrogen goes high when the endometrium is thickening, getting ready for implantation. So it's generally that.
So between day 1 and 14-ish on a standard 28-day cycle.
Yeah, and like kind of like that. You'll notice cervical mucus is like around ovulation, and then it kind of drops after that for most people. So
you're noticing more histamine issues day 1 to 14?
But it's a delay. So you'll mainly get the estrogen built up circulating and then the histamine built up circulating both around that PMS window before the period.
Okay.
But, anytime I would say between ovulation and second part of the cycle, so having people take something that quells histamine really works because they play off each other. Estrogen and histamine, they both trigger the release of each other.
So maybe taking it during the second half of the cycle if you notice that pattern.
Totally.
Yeah.
And just out of curiosity, do you notice that testosterone or progesterone stabilizes the histamine? Because I've definitely heard that in like the MCOUS community.
Progesterone will if people are ovulating, because that's how we release progesterone. That helps. I think mainly because it balances out the estrogen. Estrogen doesn't exert as many of its effects if it has the progesterone to quell it. Progesterone's a neurosteroid too, so it just calms, even if the histamine is binding, it sort of calms the response.
So the estrogen is the one that, like, that's what you've...
And that's why perimenopause, we see a lot of histamine for people, is because you have you have a higher level of, on average, estrogen, but you're not ovulating as regularly, so that you don't have the progesterone to keep it in check.
To blunt the response. Right. And so you're having these fluctuating levels, they're generally higher. Yep. It's triggering more histamine spikes.
Yep.
Sounds like fun.
I do think testosterone has a role in it also. I think testosterone also stabilizes histamine.
Yeah.
I'm not quite sure how.
Yeah.
But I think that's what I think that's what I've noticed as well.
Cool. Yeah, lots of routes in. So, I guess for this, if people are bloated and you think it's a histamine thing, don't forget your hormones.
Yeah.
I think it's great to ask, are there different times of your cycle?
When it's worse.
That
makes sense.
Obviously, premenstrual bloating can be caused by so many things. Progesterone causes fluid retention and bloating and slowing down of the digestive tube to begin with.
Yeah.
But histamine could definitely, are they also rashy around that period? Histamine's an excitatory neurotransmitter, so is your anxiety also worse?
Right.
With that? Do you need your Claritin more?
Oh my God.
It might be easier to just take it the whole time rather than try to time it but you could, it's good to notice the pattern, but then it might just be good to kind of stay on something.
So you are noticing that you will give famotidine during their second half of their cycle and their PMDD is not as severe.
Correct. In some people, PMDD is tricky, and I think there are a lot of angles in to support it. But if I'm suspicious of histamine or they already have a histamine intolerance issue, that's not helping their picture.
Yeah.
So I think adding in something. So we've also got our diamine oxidase that I'll give in that window for anyone. That's just the enzyme.
It's tricky. You got to take it before you eat.
Yeah.
So it's kind of a more...
I have some people who pop, it's hard to do that. I have some people who take it with meals and it works.
They're fine.
But
just
they need
remembering.
to take 3 to 4.
Yeah.
Or you can give B6, which helps the body stimulate more endogenous diamine oxidase production.
B complex for many of us is helpful.
Yep. Totally. So, and then we've got cromolyn, ketodopin, all those.
So that I usually will start with either an H1, H2, mainly because I want to get a yes or a no, right?
Yeah.
Does the bloating get better with me treating this one thing, this histamine thing? If the bloating gets better, I know where I'm going, and then I'd start pulling in the natural stuff.
Yep.
But in some ways, it's cheaper to do the pharmaceuticals.
A lot of people don't tolerate cromolyn, though.
There's a compounded option.
Yeah.
And great. If you don't tolerate growth, that's important.
I think that's the tricky thing about histamine from a clinical standpoint is you have to shop around. If they don't respond to the H1 or H2, you can't give up. Some people only respond to cromolyn, or some people only respond to quercetin.
Or ketotifen.
Yeah.
And it somehow doesn't knock them out.
Even in the daytime. I know.
I feel like histamine people, ketotifen does not knock out.
You've said that, Alana,
Yeah.
but I mean, it knocked both of us out, right?
It would definitely knock me out, but I'm not a histamine person.
I mean,
thank God.
I have anaphylactic allergies and such, so that's not true for me. It just knocks some people out is all I can say.
I think it's like everything in medicine's a spectrum. But
everything in life is a spectrum.
It must be some SNP or something.
Yeah, probably.
We just don't have a lot of research on it because it's not an oral
coffee doesn't make you crazy, right?
I think it does, which is why I was crazy last week. I started drinking it again. That's another story.
That's another. That might explain a whole lot of stuff, actually.
Yeah, I'm back on the chai. Should be better this week. We could only hope. I'll do some box breathing. Or no,
4-7-8 breathing.
I can't even remember the numbers. That's the
4,
problem.
7, 8.
All right, 4, 7, 8.
It's just 3 numbers. You've done way worse on me. Way worse in memorization.
All right, 4, 7, 8. We'll try it next week.
Do it. Yeah. If I'm like having trouble getting to sleep, my mind's racing, or I'm just like mad at someone.
You never get mad. You're like an angel on earth.
That's right. Yeah. I'm just really peaceful all the time. It really helps.
Okay, 4, 7, 8.
Yeah,
rather than
box
counting
breathing
sheep.
really helps me. Box
Does
breathing.
anyone count sheep?
I actually had one of my 5 nights of insomnia a year last week, and I was counting sheep.
Did you just visualize the sheep and saw them jump over?
I don't know, and I was desperate. Okay, it was that or Benadryl.
Did the sheep talk to you?
I was just like, wow.
Did it say, go to sleep, honey?
I was just like, I haven't had to do this in a really long time. I'm counting sheep. No one does that?
No
For
one
real?
does that.
I'll
For
do breathing.
insomnia?
We're going to get a bunch of comments on all the people that
If you count
but-
sheep, let us know.
Yeah. And how many sheep are you counting is my question.
Try the try the non-box.
The other thing about histamine that will lead us into our next chunk here is there are bugs in the gut that produce histamine.
Yeah, it's unfortunate.
So, if you are noticing someone's just really histamine, make sure you're not missing that piece, because you might be able to get them off their meds or, reduce what they need to stay stable because you treated one of the underlying causes.
And there's some probiotics that are supposed to degrade histamine.
Yep. Yeah, they make tons of those blends, and some that add more histamine.
And some even actually work.
Yeah.
Yeah, that's what I'm not sure about. So.
Yeah,
I've seen them help. I don't know if it fixes the whole thing, but you can make it worse by giving the wrong probiotics
It's true.
to people. So that's true with everything. Okay, so next section here, microbiome causes.
Oh, that's a big section.
Yeah. Should we just popcorn a bunch of them?
I mean, SIBO.
You took the low-hanging fruit.
I did.
SIFO.
Yep. Protozoa,
Parasites.
heavy metals,
Worms.
toxins.
Just
in
certain
the gut.
strains like Morganella, those can release a bunch of histamine. I think any kind of dysbiosis is going to set off probably an inflammatory response in the gut.
More histamine.
And then your body's going to respond by making histamine because that's part of a normal immune response.
Yeah, and even if we go back before that, we can talk about just how, living in a society where we're not exposed to pathogens on a regular basis, we're not exposed to dirt, changes the way our immune system responds. We're more Th2 dominant.
Yeah.
That makes us more, in fact, that makes us
Epidemic of absence. What was it? The book?
hygiene hypothesis is the one I always think about.
Okay.
Epidemic of abstinence. Yeah, that makes perfect sense.
I can't remember. There's a book about it.
And so what we're saying is something else that can cause gas is any kind of changes in the microbiome because it changes the way we ferment.
Yep. Totally.
That makes sense.
Yeah.
And sets you up for a pro-inflammatory state, which is going to decrease your enzyme production and other things that just help your gut.
And then don't forget
digest.
about the nature of having intestinal permeability or leaky gut. That does change, how we are responding, how our digestive system is responding to a bunch of things, which could definitely make more off-gassing.
Yep. Yeah, vicious cycle. So anyway, those are treat the underlying causes. Lots to pick from out there, unfortunately for us. So another section that overlaps with this as well is inflammatory. I would call it inflammatory or maldigestion.
Yeah, explain that. What were you thinking about with that?
So I think all of our IBDs would fit
Yeah,
into
right.
that. I think exocrine pancreatic insufficiency, bile acid malabsorption issues. If your gut tube can't do its job right,
You are going to get more gas.
yeah, celiac disease.
Oh, yeah.
I would say, and that's for a bunch of reasons, like the burden it puts on our pancreas, gallbladder, liver to pick up the slack when it can't do its job, and kind of the interplay with that, and obviously back to inflammation. If your gut's inflamed, like frank inflammation in the case of Crohn's or ulcerative colitis, probably you guys too see people who are bloated when they only have Crohn's of the large bowel.
You know what I often think about?
Or microscopic colitis too, right?
Oh, microscopic colitis is rough.
That has nothing to do with the small bowel, in theory, but they're bloated.
Yeah.
Something's up.
So 85% of Crohn's patients have some kind of disease in their ileum, especially their terminal ileum. That's where it's generally found, which is exactly where the valve is.
Right.
And that valve, if you're having inflammation of where the valve is, obviously it's not as functional or robust as it should be. And so you end up trapping a bunch of gas that way.
But also you're probably like the barrier from the large intestine to the small intestine isn't intact. So you're
it's
probably
back up.
seeding for sure.
You're almost definitely seeding. Yeah.
Yep. The ileocecal valve, it's just, man. It's another thing I work on a lot with my hands is like trying to just get some tone back in that for people. And a lot of people do that work, but that's
Does it work?
Yeah. I mean, I will have people release a lot lot of gas in office. Just
Do you wear a mask?
tugging on that. I like when I have my rooms with windows open. But
it's fine. Everyone has gas.
I usually get
normal.
my people pooping by then, so it's not as
not as bad.
malodorous. But
It's true.
I mean, I feel for people. I've spent a lot of my life really bloated too, so it's really nice to get that out for folks. So
yeah, I mean, definitely the maldigestion disorders, that's totally a thing. It's just not comfortable. You know what I mean? And then you end up getting distended. A healthy digestive system is one that you're not noticing.
Right.
When you've got any of these, it's impossible not to notice it.
Yeah.
You spend your whole day thinking about what your GI is doing.
I know, for sure. It like sucks up all your energy and time.
It's so exhausting.
I also would say, back to infectious, we didn't mention H. pylori, but that can make people bloated. And that's an infectious, element here too.
Do you think just from hypochlorhydria?
Well, that was my link here is back to maldigestion. Hypo or hyperchlorhydria or bile acid malabsorption of any variety will affect
Can we visit hypochlorhydria? Because for me, this has been, when I graduated school, when I was in school 20 years ago, right? Everybody, hypochlorhydria, everybody was taking HCl or apple cider vinegar, hypo, it was everywhere. And then I got out of school and, as whenever you practice, you go through different stages of your practice. And I was like, you know what? There isn't a single study on hydrochloric acid.
Well, no, the when they used to do the Heidelberg capsule test, they said it was about 50-50. I don't know if it was an actual study, but it used to be about 50-50 high or low.
How well validated is the Heidelberg capsule test?
I don't know, Anna. I thought it was validated back in the day, no?
I don't know.
Okay.
So then for a long time I was like, no, I can't take HCl if you want. I'm not going to recommend it to you. I'm not going to prescribe it.
Never.
Well, okay. So then all of a sudden I started getting a rash of patients come in who on their own
just
trialed hydrochloric acid because of somebody on social media.
I see it work.
And I see it work so well.
I see it work with
we make
meat.
less stomach acid as we get older, right?
Yeah.
You see it work with meat?
People who have like difficulty eating meat, whether it's histamine or not.
Right.
I see HCl help.
I have seen it work with chronic GERD. Like I have a LPR chronic GERD population, and the only thing that works for them is HCl. And those people often will need B12 shots. So there's something about the pepsin, the HCl, and the B12 that affects absorption. I've seen it work remarkably. Like sometimes that is the thing to reverse their LPR.
Pernicious anemia?
No, because I'm checking them for
autoimmune?
No, I'm checking them.
Wait, you're talking about for reflux, Alana?
For LPR, like bloating, dyspepsia, LPR, GERD, like that type of
LPR
presentation.
is the form of reflux that you're talking about?
Yeah, it's like the more severe form of reflux, yeah.
Yeah, I don't know, because with the pH probes, you would think they'd be able to tell if it was too high or too low, but I haven't looked into it.
One of my colleagues who during his residency was doing Heidelberg tests was saying that he was running them, and he was like, we have the patient swallow, and then they lay on one side and they lay on the other, and he was like, it was so positional. Like it would drastically change if they laid on the other side. He's like, I guess I have a hard time believing that the stomach can't circulate all of that. You know what I mean?
Or we're too stagnant in our abdomens.
I mean, we definitely are stagnant. But so now I am the opposite. I am way on the HCl train.
Yeah,
and it's cheap. It's a cheap intervention.
Exactly. I think it's worth a try for some people. Do you use it?
I've always been nervous to advise using it, especially if they have any history of gastritis but I don't know of any like publications on using it.
The only publications on using it is with people who have some kind of anatomical alteration secondary to surgery. So they're on a parental nutrition or something like that.
Okay.
They have never, and I it's been a second. It's been like a year or two since I've done a lit search, but I tried to look pretty extensively. I could not find a single study
I think what I was doing is more like make sure they had, because you need zinc to make hydrochloric acid, so make sure they have enough zinc, do bitters, stuff like that to stimulate it upstream. But if, I think it's within your guys' field to do it. It makes sense,
Are you giving just HCl or are you giving ox bile enzymes?
No, I'm not giving it with ox bile. I am usually giving HCl and pepsin.
Yeah.
Yeah. Yeah, those are the two that I'm using together.
Yep.
Oxbile has its own gifts and curses, so I'm not necessarily matching them.
Yeah, the combo products seem really appealing that have like all of it in one, but I don't think the dose is high enough.
Right.
And like each of these things can make people worse.
So
Yeah.
the other
So you
piece
don't
of
know
that,
what's what.
so the other piece of that is one of the things that was going around a lot when I was in school is the titration. So you take like one pill,
Yeah.
no burn, take two.
And I don't think that's been validated.
I
I
think
think
that is
that's
a terrible
dangerous.
idea.
Yeah.
I think that's a terrible idea.
Yeah.
1, 2 caps max. Apple cider vinegar bitters are always going to be safe. I don't know if they work as well.
Right.
Like some people need the HCl
Yeah.
and pepsin.
Yeah.
And do not titrate up until you have a burn because I think that's going to cause gastritis.
Yeah.
Our innervation is so different person to person, so it's not a good like metric because what some people like people with visceral hypersensitivity
Right.
are going to
They're
feel
gonna-
a lot more than
it's
someone
true.
else.
Oh, for sure.
And the risk
Yeah.
is like burning a hole through your
Right,
stomach.
right,
And you're
right.
doing it after they've eaten
don't want
some
that.
food.
I will dose it in the beginning of a meal.
Right. Like you do your enzymes,
I
pancreatic
also
enzymes.
will say that if we are clear, it is a drop in the a bucket.
Yeah.
Like it is like so it's like enzymes, you know what I mean? Like they are a drop in the bucket, but there's something about the alchemy of introducing it that just helps the system. In my
Yeah.
experience, it is not bullshit.
Yeah.
Yeah.
I mean, it makes sense.
Yeah, it makes perfect. And I do feel oftentimes that's what I come back to. Like,
As we
does
get
this
older,
make
we need-
practical
yeah.
sense? Like with what I know about how the digestive system functions, does this make practical sense? And
Yeah.
hydrochloric acid definitely makes sense.
Yeah.
Yeah, I think for a lot of people, because like I think conventionally we really think it's too much acid. It's too much acid. That's the only option is too much acid. Maybe some bile,
Yeah.
dumping or whatever.
Yeah.
But reflux
Or refluxing.
Yeah, but and then it's PPI or bust, pretty much.
Yeah.
From there, which brings
Yeah.
us business.
Well, isn't
mean,
that
yeah.
when it became like a diagnosis when the
I'm
PPS
sure.
came?
I'm sure.
Yeah. Gosh, what
Anyway.
a history. What a medical history. Okay. Well, that was inflammation, maldigestion, treat underlying causes as usual.
SIBO, SIFO.
Get that inflammation down.
Yep.
Yeah. Poor motility is the next section.
Oh, God, that one is so hard.
This is a hard one. And we
Yeah.
have more drugs coming down the pipeline for it. But, there are lots of different types of motility disorders that you can have that are just like different types of paralysis of the gut. It can be with diabetes or other things that are affecting
Yeah.
your nervous system.
Gastroparesis.
Gastroparesis. is up
Gastroparesis.
With some of the
high.
meds we give
Right.
now.
Yep, meds can do it.
Like it can happen secondary to meds.
Yeah,
Oh, like
yeah.
any of the GLP-1s.
Yeah.
Or acetylcholine, like things that upset our acetylcholine blockers, because acetylcholine is a prokinetic in our body. So there's a lot. We want to do a thorough drug history on people, but you want to think of your comorbidities with this because there are certain conditions that
Yeah.
are going to slow down your digestive tract. Parkinson's.
Oh, yeah. That's now we're moving that to a GI disorder, not even a neurological
Yep.
disorder anymore.
And anticholinergic, right? So the
Yep.
H1 blockers we're giving people.
Yeah,
Yes, they can. Yep, for sure, they can slow things down.
that's right.
Yeah.
That's
And
right.
I also
And cause
feel
weight gain.
I don't know if it's true, but I feel like I'm seeing more gastroparesis than I've ever seen before.
Yeah,
From-
young people.
Yeah. I don't know from what I just
Yeah.
see. I mean, maybe it's because I've been practiced longer.
You're
Do
seeing
you
it
think
on
it's
testing.
sugar?
What's that?
Do you think it's sugar or damaging people's nerves?
I mean, that's one, or maybe it's the chemicals. I mean,
Environmental toxicants.
yeah.
That's where
Wait,
my
are
brain
you
goes.
seeing it on a
I'm seeing
gastric
I have
emptying
more
scan?
patients coming in
With the gastric emptying
gastroparesis
scan. seeing-
diagnosis. Yeah.
And they don't have
Oh.
diabetes.
and they don't necessarily have diabetes.
Have we done a gastroparesis episode?
I don't know
Who
if we have.
knows?
We should.
Yeah,
We'll
we
have to
should.
I
check.
have good thoughts on that one too.
Okay.
Another thing I want to put in poor motility, not to forget, is marijuana.
Oh, right.
How does it affect motility?
Slows it.
Okay,
Slows it,
that
totally
makes
slows
sense.
it.
And I
It
don't
slows
want to
everything, right?
pass a judgment on marijuana as a medicine. Like it has a ton of good things and it has a ton of things you just have to have on your
Yeah.
radar as well. But the real trick here, this is one of my trickiest clinical challenges from a patient standpoint, is people use marijuana to stimulate appetite and curb nausea, which goes with slow motility. People don't want to eat, they lose weight, life is miserable, they don't enjoy it, and they're nauseous because their motility is slow. And the marijuana works for that, but it's slowing down the tube. And we think, we all know cannabinoid hyperemesis,
Yeah.
where you vomit. That's really, really tricky because people won't get off their marijuana despite how miserable they are. And you need to be off it a long time to determine benefit.
You think?
Yeah,
It's-
months.
Months.
It's interesting
Yep.
that it helps with nausea, even though it works against motility.
I know. Yeah, it must be other neurotransmitters.
Yeah.
But it will slow down the tube and can cause bloating and any kind of sluggishness in the digestive tract.
And people don't want to
tube.
stop using it.
No.
No.
It's a really hard because
Yeah.
like alcohol, it serves a lot of purposes.
Yeah.
It might be social, it might be relaxation, it might be mental health support, it might be appetite stimulant. it wears a lot of hats for people. So it's our mistake in healthcare to be like, you just need to stop your marijuana. No one's going to do that.
Yeah.
Yeah, it hasn't been very effective.
No, you have to really, like, I really get into it with my patients of like, what is this doing for you? And how do we come up with a very comprehensive plan, knowing you're going to need some buy-in here? Like, life's going to suck a little bit more.
For a couple
you're gonna
weeks
feel
at least.
things.
Yeah, and it's going to be harder because it's not as like honed in of a pathway for you to just get that easy whatever it's solving for you. But
Yeah.
I mean, ask your patients about that because it definitely can cause bloating.
Yeah.
Yeah. That's a good one.
Yeah.
Yeah.
And then, things like our methane positive SIBO can cause small intestine paralysis. So even if we eradicate SIBO or post-infectious IBS or however we want to call it, you can still have the delayed transit from that after treatment.
Yep.
And that is really where I lean into our prokinetics, whether it's
Yeah.
herbal or pharmaceutical.
Yeah. Our prokinetics are, for some people, very, very useful.
Yeah.
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 Big time. For the whole tube. They just move the tube. That's
Yep.
what prokinetics are. So, but if it's a really pesky bowel or small bowel case where people are bloated, we've talked about prucalopride.
Yep. That's my
Low dosing, even the higher dosing,
Like a quarter milligram.
exactly, or
Quarter to a half.
yeah.
because the standard dose for chronic idiopathic constipation, which is what it's FDA approved for, is 2 milligrams unless there's renal impairment. But I think even lower doses for just small intestine bloating, like maybe they're pooping fine,
Yeah.
but
Yeah.
their small intestine's bloating.
Yep.
Use that lower dose.
Yep.
And it works great.
Did you guys ever see, because it comes up with the warning for mental health and depression, and that scared off some of my patients from using it, but I never saw that it did that.
I have seen it.
You have
in
seen
a
it.
handful of patients.
Okay.
I have definitely seen. I've been prescribing it since 2013, probably, maybe 2014. So I have thousands of patients who have
Yeah.
taken it. I have seen mood effects probably in about 10 of them. So
And it's
not
like-
none.
Yeah.
The nice thing is, if you are noticing those mood effects, you discontinue and your mood stabilizes.
Is that the higher doses, or are you noticing it in the lower doses?
I'm not sure.
Yeah.
And do we know
usually
how it's causing the mood effects?
just because it's
it's-
working on the 5-HT4. It's
a
working on the
serotonin
5-HT.
receptor
Yeah.
agonist.
So it's the same as like SSRIs where we tell people it could.
Well,
Sorry, I don't mean mechanism. I mean we
Yeah.
tell them for a small subset of people it can cause increased.
But the difference between this and things like SSRIs that are still working on serotonin receptors is prucalopride has 100-fold more sensitivity for the gut receptors, which is why we also don't see those like heart effects that we do for other drugs.
Right.
That work on serotonin. So it's very.
So it's like
unlikely.
Testragard.
I've
Tegazard.
had Tegaserot.
So, yeah.
Who knows?
Yeah.
So
Yeah.
you've had very minimal patients with
Like maybe nothing severe, no
Yeah,
like
yeah,
suicidal
yeah.
ideation.
Yeah.
I mean, I think, and who knows, because I really inform people about it, and who knows what we're setting up for that.
I know. That's why I was like, am I
Yeah.
implanting the
But I will, like, if my folks have a history of suicidal ideation
Yeah.
or attempts, I'm like, I don't go there
Yeah.
with them. But it's like the only drug currently on the market in the US that does this.
and we think it's just because it works on that
It's just working
neurotransmitter
on the
like,
motility.
right.
So
but
serotonin is the main propulsive force.
yeah,
in
but for the
whole
mental
digestive
health
tract.
effects.
Yeah.
Yes.
Just because
Yes.
it's part of that neurotransmitter system
Yes.
I think
for
that's
some
the
people.
obvious cause. I mean, it's also maybe disrupting other neurotransmitters as it starts to get you
Yeah.
digesting.
Yes.
Yeah.
But I don't
So
know.
my guess is yes. Yes, I have seen it, but
Yeah.
very sporadically.
Yeah.
Yeah. But I do. I mean, I also park you everybody.
Yeah.
Like
Yeah.
you have to.
But
Yeah.
relative to the tardive dyskinesia,
Right,
some of the
right,
other
right,
drugs
right.
out of
The other meds.
the heart,
Yeah.
I think it's a much safer drug,
Right.
and it's a game changer for some people that just have really chronic bloating.
You're talking about like compared to Reglan,
Yeah.
whatever. Yeah.
Metaclopramide.
So I have a patient right now who is so, it's bad. You know what I mean? Like his constipation is so bad. His bloating is so severe. And right now I have him on double dose prucalopride.
Wow, like 4 milligrams.
2 milligrams in the morning, 2 milligrams at night, because that helps some people.
Yeah.
And I keep on, and he's got I don't know, he doesn't have a gastroparesis diagnosis. I'm not sure why, but he clearly has gastroparesis. And I'm like on the verge of starting him on Reglan. And it worries me, but I'm also like,
we used to, and I did learn, I mean, our gastric emptying scan is not super sensitive. I can't remember the exact
It's not
sensitivity,
good.
but we used to use metoclopramide all the time. And now it's like some of these drugs we used to just hand it out, and then all these warnings came out later. Like the same thing with gabapentin, like we used to just hand this stuff out at max dose.
isn't gabapentin still handed out like candy?
I mean, there's more warnings that pop up.
Yeah.
But I mean, so I
Yeah.
looked into the FDA warnings, and I think it was mostly in combination with other drugs that there was more concern. But metoclopramide, it does seem like we've way reduced the prescribing
So
of
when
that.
you were in residency, you were using it
We're
a lot.
handing it out. Yeah, I mean, but it was
It
mostly
works.
diabetic gastroparesis.
Don't you see? I mean, do you see a tolerance to it over time?
I can't think of one patient that I've seen in the last year that has been on it, which is weird.
Yeah,
compared to
But
how
with
it
your
used to be.
population especially.
Yeah. I think the other thing comparing that to motegrity is precaliprate is we do have data on it regenerating nerves, unlike
which
all
is
the other
wonderful,
options.
yeah.
So, I think I have seen a tolerance, and we'll get to gastroparesis in apparently another episode, but people have to switch drugs
to the older meds.
pyridostigmine or other things that are just moving different
Yeah.
neurotransmitters.
Yeah.
And I think motegrity sometimes there's a tolerance to it, but sometimes I also see people get off of it.
Yeah.
And even the
starts
natural
working.
ones, we were always taught you have to keep rotating them. Do you guys still find that to be true?
Not necessarily. I mean, I usually the answer is yes. I think that everybody's going to develop tolerance to everything. It doesn't happen quickly.
Yeah.
Like they can easily take something for a year or two, and then oftentimes they'll just if you're
they
cleaning
don't
up the
need it.
underneath mess, they don't need it as much.
Yeah.
And I think herbs are easier to pulse. So you can do 2
Yeah.
weeks on, 2 weeks over. As for a lot of our herbal ones, I'm like, if you feel something coming on or bloating's creeping back in,
Yeah.
just have it in your medicine cabinet
Yeah.
and start taking it.
If you find that's the one of the 7 causes of their bloating.
Yeah, I mean, it is a really good
Pillars of
reminder.
bloating.
There are 7 causes of bloating.
Yep, 7
At
camps.
least.
Yeah.
Yep. So the last one here, finally made it to number 7, finishing up with poor motility, is other structural. And we've talked about this, kind of throughout this episode
Yeah.
and last, but hypermobility, which can be all the way to Ehlers-Danlos, but that's definitely a spectrum. And I've had people where it really was just their guts.
Yeah.
And even feeling it, things just move in there.
Yep.
I can
Yep,
feel
yep.
things kind of saggy and just they feel different.
Yep.
And I think for folks that get better with different postures, that's almost like a telltale sign, is because if they roll, things move. They change. Their bodies just need that extra support. But other structural would be maybe more adhesions or
Fibroids.
totally
Yeah.
Oh, yeah.
Because they
bolting
might
the
not know
path,
that they have fibroids, and then
for sure.
Anything that's
Polyps.
taking up space.
Yeah, polyps, cysts, whatever.
Yep.
In there. Yeah, and we don't have a lot of room in there.
No. And things can get in there that shouldn't be in there, and that affects how everything moves.
Yeah.
Yeah, for sure.
So we got to get.
But
the
I
tube
will.
moving.
I mean, I do want to give a shout out to for a long time I was underutilizing visceral manipulation, sending to a really good PT or chiro who can get in there and kind of what you do, feel the viscera and move it.
Yeah.
And that for some people, it's it's not the first thing I think about. It's not often where I start, but I'm often angry at myself for not starting there sooner.
I think again back to what we said in the first episode, it's like a pie chart
Yeah.
of how many ways in. So if getting the structural stuff moving helps them 30%, that's 30%.
Yes.
Yep.
And if we can get the microbiome fixed and that's 40%, we're well on our way
Yeah.
Yes.
of sort of treating stuff. And it's rare that just doing visceral helps everything.
Right.
But it's a way in that I look at to help people that isn't another pill.
Yes.
They don't really have to do much on their end. And none of us move our abdomens the way really we were designed to move.
Yeah, we're not actually moving our bodies the way we were designed to move.
So I'm helping circulation, I'm helping movement, I'm helping actually get gastric contents through or intestinal contents through, and that's a win-win.
Yeah.
Yeah, I would agree.
So don't forget that piece.
Can we just do a quick drop at Prokinetics?
Yeah.
Because there's a prokinetic that has been on the market that has amazing research that's recently been reintroduced to the U.S. market.
Oh, I didn't know that.
Well, it's a bummer. I'm going to give you bad news, not good news.
They reformulated?
So it goes under, in the research, it goes under STW5.
Oh, yeah.
It's by brand, it's called Iberogast.
Yeah, they're still calling it that?
Yes, they are still calling it that, but they have taken out a third of the formulation. And so if you're buying Iberogast in the US and it's a 6 formula blend, that is not what the data is on. The data is on the 9 formula
Do you know
blend.
why
Because
gutted the
I think
recipe?
they took out the liver herbs. So they took out milk thistle and I can't remember the other 2 herbs they took out. And those somebody died from something in one of these herbs. I mean, we've been using these herbs forever.
Yeah.
But they're so on the so it actually makes me kind of crazy because I got really excited that it was re-available in the US.
Can you still get it through?
You got to get it through Canada.
Yeah.
You can still get it through
The old
Canada.
formulation.
Yep. And so it's really important. I'm now educating my patients.
Does it have more licorice in it?
They don't. It's a proprietary blend. They don't tell us how much of what.
Does it taste more like?
I haven't tasted it, but the one that you're getting that's in the U.S. and it's like it's owned by Bayer Pharmaceuticals. So I have like commercials coming up on when I'm watching like the show with the kids, like on Peacock at night. Like they are like forcing money into it, and it's a completely different formulation. It is if you are getting
citing the research on it. Are they saying?
No, I mean not in the commercials.
Yeah.
It's a 6 herb blend. What you guys want is a 9 herb blend. Yeah. The original 9 herbs from
Germany.
And like they're not the only show in town. There are tons of herbal formulations out there that are great.
I like that one because it's a liquid and it has such good data to push motility from the esophagus all the way down through the colon.
Yeah, and it doesn't taste awful.
No,
like, there's some really bad taste.
And I feel like people, like at least I am getting pilled out. I'm getting real tired of pills. And so that's the other reason why I like it, because it's not a pill.
Yeah.
Totally. Yeah. Well, we do have a whole episode, maybe 2, on prokinetics. So we've got our herbal ones, our pharmaceutical ones.
Yeah.
A lot of overlap with constipation because, again, just moving the tube here. But go ahead and listen to those if you want more insight there. They're hugely useful in bloating.
Yeah.
This was great, Dr. Sam. Bloating is like, we see it all the time.
Are you feeling less bloated?
I was okay today, but I'll see the next time I'm having issues.
Well, I know what to do now.
That's right. I'm
going to do 4-7-8 breathing. It's going to fix all my problems.
Yes. Some of them, maybe.
Great.
Anyway, thanks for tuning
in.
in.
Everybody.
Next time.
Bye. Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.